Ozempic, wonder drug for weight loss or another pharmaceutical nightmare in the making? Be careful what you wish for. What is Ozempic? In 2012, Ozempic was developed as a once-a-week diabetes therapy that acted longer than previous diabetes drugs. Then, in 2021, a study published in the New England Journal of Medicine showed that weekly injections led to an average of 15% weight loss for overweight and obese people. The stage was set for a drug to go nuclear, for abuse to become rampant. Think about it. A weekly injection that allows you to lose dramatic amounts of weight without any work or changes in diet and lifestyle. That's basically the holy grail of weight loss. But every drug comes with a trade-off, and the weight loss is technically an off-label use of this drug. An off-label use implies that an FDA-approved drug is being used for an unapproved use and therefore not technically designed and researched for what you may be treating. That means there can be many unknown consequences. At no time will there be a drug that allows you to maintain a healthy body weight and eat irresponsibly, nor will it allow you to reach optimal health even if you are within healthy, normal weight range. This isn't to say the weight loss is inherently bad, just that it is a crutch, like most pharmaceuticals, and comes with downsides. Ozempic works by increasing satiety, basically making you feel full faster, similar to bariatric surgery. It does this in two ways. One, it mimics a hormone called GLP-1, glucagon-like peptide 1. In the body, that regulates insulin and plays a role in helping us feel full after a meal. Two, it slows gastric emptying, so you are technically full longer because the food is taking longer to transit through your GI tract. Sounds amazing, right? And totally helpful? Well, there are some severe downsides that I'll share. By the way, this isn't the only way to do this, and there are foods that can slow gastric emptying as well as sensitize the hormones that increase satiety that I discuss in other videos on my website and in appointments with my patients. So, who's using it? Probably more people than you know. It's not something readily discussed in circles. Certainly famous individuals who are paid to be thin. The ones that have shared their experiences are Sharon Osbourne and Oprah. They've been very vocal about their journeys. Sharon has gone so far as to state she's lost too much weight, and now she's having a real hard time putting that weight back on. These are the unknown downsides. Individuals that abuse this for quick weight loss can see difficulty, like Sharon, in keeping weight or even stopping once they've got started. The rebound effect when they come off the drug is very real. There are always side effects with pharmaceuticals. Despite the smiling, happy individuals in the commercials who are living their best lives while these side effects are being rattled off. So here are the big ones for Ozempic: constipation, abdominal pain, fatigue, rapid heartbeat, decreased appetite, headaches, changes in taste, nausea, dizziness, allergic reactions, difficulty swallowing, heartburn, diarrhea, belching, hypoglycemia, which is low blood sugar, vision changes, gallstones, and my personal favorites, kidney disease, pancreatitis, and potentially even thyroid cancer. This is a laundry list of potential issues for an off-label drug to assist in weight loss when there are natural alternatives and methods. These are the big side effects, the ones seen most in clinical trials. This doesn't even include all the other issues patients have that are reporting among a smaller minority, which could still end up being hundreds of thousands of people worldwide taking these medications. I have personally seen in my practice hair loss, mood changes, and gastric distress from regular use. But what about issues that maybe aren't being reported in the side effects list? Let's look at one of my personal concerns, sarcopenia. Sarcopenia is technically the term for muscle loss due to natural aging process. Most people don't understand the importance of muscle on the body in general. We see it as just something to assist with movement or to increase in order to look like a superhero, but it does way more than that. Increasing or maintaining muscle mass is crucial from everything from metabolism and brain health to immune function and healthy aging. The more of it you have and the longer you maintain it, the longer and higher quality of life you will obtain. So they ask, therefore, wouldn't Ozempic be great for health? Reducing body fat so we can have more muscle? Unfortunately, it doesn't work just like that. What ends up happening is a chemical reaction where, because we are mimicking and blocking some specific functions of the GI tract, the body becomes catabolic. This means it begins to tear down muscle. Without wasting your life going through the whole process, the body maintains the blood sugar by not only utilizing fat but breaking down muscle. You can end up losing a significant amount of muscle mass along with the fat that you're so desperately trying to lose. This is being reported quite consistently now, and it is being recommended that those on Ozempic follow a high-protein diet for this very reason. It's a workaround for weight loss I would rather avoid for myself and my patients. All the issues I have mentioned pale in comparison to the lawsuit I saw just the other day. There are several individuals, and therefore, like I indicated, probably thousands of others who have suffered gastroparesis as a result of these weekly injections. Gastroparesis is the paralysis of the stomach muscles that assist in moving food through the digestive tract. You can see how that could be bad for a number of reasons. Specifically because it causes symptoms of vomiting, nausea, abdominal bloating, abdominal pain, acid reflux, among many other issues. This is not something fun to potentially have to deal with for the rest of your life. Worse yet, a news article the other day indicated an unidentified woman is suing Ozempic because it caused such severe symptoms that she had to undergo an 8-hour surgery, and when she awoke, she was told by her treating doctors that she will now suffer daily pain forever, and also suffer chronic diarrhea for the rest of her life. Think about that. Not just a day here or there, but every day. Going to work, going on vacation, going to dinner, always diarrhea, all the time. Is that worth cheating the body to attain some beauty standard? By the way, I would also like to mention that if anyone is aware of this individual, or is this individual, I would be happy to see you and give you a second opinion on this diagnosis. Every patient that comes through my door has been told they have an issue that cannot be resolved, and my results speak for themselves. You can read any number of my reviews online. Send this video to anyone you feel may also have been impacted in a similar fashion by Ozempic, please. Okay, so weight loss isn't well understood by most people, and some feel it's a cruel hand they have been dealt. There's some truth to genetic conditions making some weight loss harder, but the problem is, again, how it's being viewed. Conventional medicine is informing you the only solution is to starve yourself, count calories, reduce intake. To the contrary, there are many different ways to achieve the goal of optimal weight. There are supplements that assist with this, but again, there is no magic pill that spurs weight loss that does not come with other issues. Believe me, if I was aware of the magic pill for weight loss, I would be selling it to you, not keeping it a secret. And I've tried everything. Trust me. The secret is to optimize organ function, which I keep talking about. My protocols are designed to do just that. They break down, help absorb, and utilize nutrients more effectively to allow the body to function optimally. From there, you of course do need to incorporate some movement exercises. I'm not a personal trainer, but we can all agree that we move less and eat more these days. The real trick to losing pounds is understanding how the body works to address energy needs. Here is the simple fact. Food is ubiquitous today. You can eat nonstop all the time. The body is not meant to be in a fed state consistently. It impacts metabolic pathways negatively and leads to negative health outcomes. So, meal timing and fasting, which in trials also show an average weight loss of up to 15%, same as Ozempic, making it very similar to results in their clinical trials, are something that do need to be a part of every adult's life. Adults, not children. Couple that with real foods first, and you set yourself up for optimal weight. The additives and chemicals in processed foods drive weight gain. Simple as that. I address all of this and more in office visits, and will continue to do more detailed videos on solutions, but this overview is to inform you and everyone that obtaining optimal weight is, number one, not solved with an injection or pill, and number two, quick solutions like any quick fix can come with some serious downsides. Don't risk your health for a quick fix. Follow me, subscribe to my channel, contact my office, utilize Dr. Duke's formulas at drdukesformulas.com, join Real Foods First, realfoodfirst.org, and you will achieve optimal health and an optimal weight. The information is all available. You just have to learn what you are doing wrong. Knowledge is power, and unfortunately, very few people understand how the small things they do on a daily basis have a huge impact on the goals they are trying to achieve. In good health.